Hello and welcome to this Top Tips for Breathing Well talk brought to you by the Aneurin Bevan University Board Symptom Management Service. This workshop is intended for people who are living with symptoms of breathlessness, as well as relatives, carers, and healthcare professionals looking to learn more about managing symptoms of breathlessness. This workshop is aimed to be educational and to provide tips and advice to support your management of breathlessness symptoms. Due to the range of individuals accessing the workshop, our workshops cannot be tailored to individual circumstances. Therefore, some parts may be more relevant than others. Please contact the Aneurin Bevan University Health Board Symptom Management Service using our contact details at the end of this session, should you wish to discuss anything further. During today's session, we will look back at some anatomy related to our breathing, including understanding our lungs. We will also discuss some management strategies for breathlessness, the link between our breathing and our brain, as well as some important lifestyle and general health advice. This slide is to recap some basic respiratory anatomy. You have two lungs, right and left. The right lung is larger than the left. This is as the left lung has to share space with the heart. In your chest, air moves through the windpipe or the trachea. The trachea splits into two smaller airways called bronchi, and each bronchi continues to split into multiple smaller airways called bronchioles. At the end of each bronchiole is an air sac called an alveoli. Your lungs and heart are protected by your rib cage. Breathlessness is a subjective, distressing sensation of awareness of difficulty with breathing. Getting out of breath is completely normal. It's more commonly seen as a natural response when your body needs more oxygen and energy when you do something that requires physical effort, for example, when you run for a bus. Getting out of breath when we exercise or move is a positive reaction and part of keeping our bodies fit and strong. But some people get out of breath whether or not exerting themselves. They unexpectedly find it difficult or uncomfortable to breathe and may feel they can't control their breathing. So how do we breathe? We breathe because we need to intake oxygen from the air. There is around 21% present in the normal air we breathe, and we also need to breathe out carbon dioxide from within our lungs. The rib cage moves in two directions within breathing. One is known as the bucket handle movement, which increases the outward movement of your ribs, and the other is a pump handle movement, which increases the front and backward movement of your ribs. Your muscles within the respiratory system help this occur. If you have weakened or less functional muscles, then this might contribute to breathlessness. If you have stiffness in your rib cage or the joints around your rib cage, this might also contribute to breathlessness. Poor posture and increased weight can also significantly affect your breathlessness. On the screen now are some positions you can use to ease your breathlessness. Try one of these positions. You may prefer one or more than the other, depending on your other health conditions or functional ability. One option involves leaning against a wall or a bus stop with your knees slightly bent, but maintaining an upright position of your torso. The second option involves leaning forward against something like a chair, shopping trolley, or a pram. The third involves being sat down, leaning forwards with your forearms on your knees, and the fourth involves lying on your side in a supported position, for example at night time. When using any of these, try to stay relaxed when you're breathing. The next two slides show some breathing techniques which can be useful to try when you're feeling breathless. Box breathing is a visual resetting technique. It is useful to try when you feel your breathing is running away from you or you feel out of control. So how to do box breathing? You can use the diagram on the screen to support. Step 1. Breathe in, count into 4. Slowly fill the air into your lungs. Step 2. Hold your breath for 4 seconds. Try to avoid breathing in or out for 4 seconds. Step 3. Slowly breathe out through your mouth for 4 seconds. And step 4. Repeat steps 1 to 3 until you feel recentered. If you can't hold your breath for the 4 seconds, then start with a lower number initially and progress to 4 seconds when you can. Starfish breathing is also a resetting technique that is more tactile, using your hand to help support. So how do you do starfish breathing? Hold your palm facing you, fingers spread wide like a starfish. Place your pointer finger from the other hand at the base of your thumb. Breathe in as you trace up the outside of your thumb, and breathe out as you trace down the inside of the thumb. Continue for all fingers. When you get to your pinky, return to your thumb and start again. Another breathing technique, which is particularly useful during an activity or exercise, is described as blow as you go. Use it while you're doing something that makes you breathless. A lot of people hold their breath when undertaking exercise or activity, and this can further contribute to your breathlessness. So how do you do it? Breathe in before you do the task, and then breathe out whilst you're making the effort. For example, when lifting a heavy box, breathe in before you lift the box, and then breathe out as you lift it. Another example is carrying the shopping. Posture is important when lifting to be able to lift safely. Make sure you choose a task that you're able to do and be careful if you're struggling. Then make sure you ask for help if you need or break up the task so that you find it easier. For example, making your shopping bags lighter and doing more trips so that you can manage. Or consider a wheelie trolley as an example. Try not to multitask. Lots of people feel they can't get a breath in if trying to talk at the same time as eating. What we also tend to see is that they're not breathing out adequately first. So remember to breathe out fully before you then take in another deep breath. If in doubt, breathe out. Haste breathing is useful when you're more active, for example, walking, climbing stairs, or inclines. The aim is to pace your steps to your breathing. So how do you do it? Count yourself as you walk or move. For example, breathe in for one step and then out for another. Try different combinations to find what works best for you. For example, breathe in on the first step, breathe out for the next two. Controlled or relaxed breathing. Relaxed, slow, deep breathing is very useful when you're active. Use it from the start of an activity that makes you out of breath. For example, walking, pressing on the washing, doing chores, washing up, or making the bed. As you start to exert yourself, slow down your breathing and breathe in more deeply, making sure that you have good posture. Good posture includes having your feet firmly planted on the floor, relaxing your shoulders, and keeping your chest up. Breathe in through your nose if you can, and slowly breathe out through your mouth. If this feels comfortable, your resting breathing should be quiet. This means trying to avoid excessive yawning, throat clearing, or sighing. Some of these strategies discussed here can be used together, for example, controlling your breathing alongside being in a position of ease. This image shows the cycle of inactivity. If you avoid activities that make you breathless, your muscles become weaker. Weaker muscles need more oxygen to work. Over time, you feel more and more breathless. We know that being breathless can be worrying and can cause fear, which means you may avoid activities that make you feel this way. This is called the cycle of inactivity or the cycle of breathlessness. It's very difficult to break the cycle once you're in this habit. This can also become socially isolating or have a negative effect on your well-being, as it often makes you feel like you can do less and less. However, this cycle can be broken by using some of the strategies discussed and reviewing your activity levels, breathing, and brain behaviour. We know there is a strong link between your physical health and your mental health, and vice versa. It's not unusual to experience feelings of stress, low mood, sadness, or depression. However, this can directly affect the way that you breathe. We would advise that you consider strategies such as mindfulness or meditation, relaxation, online services such as Mind or Mellow Cymru, or speak with someone about it, such as your GP. In a crisis, there is help available. Please ring 111 and select option 2. Do not underestimate the importance of maintaining your general health. Here are some tips. Eat a balanced diet, sleep well, stay hydrated, make sure you exercise and undertake activity regularly, maintain a good mental health, avoid or stop smoking or vaping, maintain good social contact, try and get sunlight every day, maintain a healthy weight, and reduce your alcohol intake. Please refer to the NHS website for further information in more detail about the above recommendations. We would like to highlight in a bit more detail the importance of activity or exercise. The UK guidelines for activity or exercise are shown on this slide. They recommend 150 minutes of moderate intensity activity during a week, or 75 minutes of vigorous, intense activity. Moderate activity means being able to talk whilst being active. We appreciate that this might not be realistic for everybody, but this can be used as a target to work towards. We would encourage you to take small steps gradually and safely increasing your physical activity if possible. For example, try to take a short walk with friends, taking regular breaks and using relaxed breathing and positions of ease, such as leaning against a wall to manage your breathlessness. We find that planning an activity helps break down some barriers and increases activity levels. If you feel unable to leave the house for a walk, then there are some options on the NHS website for seated exercise programs which involve using your arms and legs to increase activity. If you need further support in how to begin activity or exercise, please consider a referral to the National Exercise Referral Scheme, which is a tailored programme taking into consideration your medical conditions. It's run in your local leisure centre by exercise professionals. Please seek a referral via your GP or practice nurse. Unfortunately, we are not able to do this via this presentation. Thank you so much for watching this top tips for breathing session, and we hope that you have found this information useful. If you have any worsening of your symptoms or symptoms you're concerned about, please contact your local GP or practice nurse. If there are any specific questions, please ask or email our team using the contact details shown now. If you have any other symptoms that you would like more support with, such as emergency management, brain fog, or well-being support, please scan the QR code on this screen and fill out the appropriate request for session form. Thank you.